If I hire a 1099 contractor, do they have to apply for Medicare credentialing on their own, or do they fall under your group plan?
Okay, so they have to get their own, it's called a P10 number. So they have to get their own P10 number in order to get credentialed through Medicare. Mm-hmm. So one way you can do this with contractors, so I hire a lot of contractors for my business, so this is a perfect question. There are two ways you can do this. One is you tell the contractor, go on PCOS, sign up for Medicare, get your P10 number, and then they can reassign their benefits to your business. And what reassign benefits means is that if I hire David as a 1099 contractor, he signs up for Medicare. When he reassigns the benefits, what it tells Medicare is that David saw the client, but we're not going to pay David, we're going to pay Fitz or his business. So that's what reassignment of benefits mean. That's one way of doing it. The way that we do it here in our practice with our admin is when somebody signs on, a lot of times they're kind of confused on how to do it and it can take more time. So we just do it for them. We actually get them logged in and we either walk them through it or we actually sign them up and then have them sign off. They sign in or they sign up and then we fill it out for them and then they can sign off on it. So those are two ways you can do it. But yes, to answer your question, if somebody is seeing a client under your business, a 1099 contractor, they must have a P10 number or be credentialed with Medicare.
I love it. And Joanne, she pointed out that, always ask a Medicare patient if they have any other insurance cards, that many will show you only their traditional card. But if they actually have a replacement plan, she's saying that this may actually delay your payments.
Yes. So like I said earlier, if Miss Lucy says, hey, here's my red, white, and blue card, I have Medicare, sometimes you shouldn't just believe that. Ask them, what other cards do you have? Do you have any other insurance cards? And then they say, yeah, I have this card. Last year I went to this fair and this lady signed me up for this Medicare Advantage, but she told me I still have Medicare. And no, you don't have Medicare. You don't have traditional Medicare anymore. This card is not your replacement. And we've had so many times, David, in our practice where somebody thought they had Medicare, they give us the Medicare card, and we verified the benefits, and Medicare says, nope, we're not the primary. That Advantage plan is a primary, and we can't see the patient. So it's very important to check that. So good point, Joanne. And then you also want to make sure you check if the patient has home health. So with outpatient, if you're working in a clinic, it's not as difficult because in the clinic, if a patient is coming to your clinic, most likely they don't need home health. However, in the home, since we can see patients who are homebound or not homebound under outpatient services, sometimes they may have a home health team in there. And no matter what happens, if that home health team is seeing that client, if you bill Medicare, Medicare will pay you, and they'll come back and say, hey, wait a minute, when you're seeing this client, this home health company was seeing this client, we want our money back, and they will actually take your payments back. So you want to make sure you ask the clients two questions. Is there home health coming to your house? They may say no. Then the second important question, is there anybody coming to your house? Because there have been many times I ask, is home health in your house? Oh no, they discharged physical therapy a long time ago. Is anybody coming to your house? Well, I have this nurse who comes once a month and she checks my pressure, but that's all she does. She does nothing. We can't see the client because they're still under home health. Even though the PT is not seeing them, the nurse on that home health team is seeing that client. So 2 questions. Are you under home health? No, I'm not. Do you have anybody else coming to the house? And who are they? I'm not trying to be intrusive. I don't want to know about Johnny, your long lost lover or something. I want to know about people who are coming to see you and treat you.